الصوت طارق. اوكي
جروبي تمام دكتور.
اشتي لك يعني طارق، تسلمون. اوكي. طبعا our lecture today we will continue hemodynamic disorders. Okay. طبعا next lecture إن شاء الله will be at 9 a.m. Sunday. Okay. يعني إن شاء الله next Sunday at 9 a.m. المحاضرة القادمة حتكون إن شاء الله يوم الأحد الساعة 9 صباحا. Okay. طبعا we will continue talking about, as I said, hemodynamic disorders, and we will talk about today about thrombosis or a thrombus. Thrombosis is defined as formation of solid or semi-solid mass from the constituent of the blood within the vascular system during life. The mass itself called a thrombus. Okay, what is a thrombus? A thrombus is mass. Let's see the thrombus. So this is the thrombus. Okay, this is the blood vessel, and this is the thrombus. So a thrombus is mass, solid or semi-solid mass, formed from the blood constituent. Okay, inside a blood vessel during life. يعني هي عبارة عن تخثر أو جلطة دموية داخل الوعاء الدموي خلال الحياة. So thrombus is يعني look like a blood clot like this that close the blood vessel. Okay, is a mass that close the blood vessel, and then there will be ischemia, hypoxia, etc., etc., etc. So this is a thrombus. High picture. So now the question will be like this. Define thrombus. So thrombus is a mass, solid or semi-solid, formed inside the blood vessel from the blood constituent during life. يعني from the blood constituent يعني RBC, platelet, fibrin, okay, during life, يعني not after death. We will see why. Okay. Now, the causes of thrombosis or thrombogenesis, يعني how? So we call it Vercau's trades. Okay, so major factors or predisposing factors or the causes of thrombosis are: number one, endothelial injury; number two, abnormal blood flow; number three, hypercoagulability state. Don't worry, we will study them in details. Now, the causes of thrombosis, why there will be look like a blood clot or a mass formed inside the blood vessel that will prevent the passage of blood to the tissue. يعني تصير جلطة أو خثرة دموية بحيث إنه تمنع وصول الدم والأكسجين إلى الأنسجة التالية. The causes 3. Number 1, endothelial damage. Number 2, abnormal blood flow. Number 3, change in the composition of the blood or hypercoagulability state. يعني increase the blood become more liable to make a clot, to make a thrombus. يعني قابل للتخثر. Okay. Now just I want at the beginning to remind you. طبعا this is the blood vessel and this is the normal lining epithelium. We call this as endothelial cell. This cell lined the blood vessel. هي الاندوثيليال cell. هاي الاندوثيليال cells. Flat, cuboidal. Okay, هذه السيل. طبعا you remember from histology, this is the endothelial cell and this is يعني هو هاي tunica intima. بعدين الميديا اللي هي المصل. بعدين الادفنتيشيا اللي هي blood vessel, fat. Okay. So now the هذا normal blood vessel lined by endothelial cell. This is the endothelial cell. Next, المصل. Next, الادفنتيشيا. Now, the first mechanism of thrombosis is number 1, endothelial damage. يعني damage to this cell. Number 1, endothelial damage. Number 2, aggregation of platelet fibrin at the site of damage, then thrombosis. يعني الخطوة الأولى بالثرومبوسيس هو دامج للإندوثيليال سيل. الفيرست ستيب in thrombus formation هو damage to the endothelial cell. هاي الانdothelial this is the endothelial cells which lined the blood vessel. Okay. خوش. Now, what are the causes of a thrombus? Why there will be clotting of blood? Why there will be mass formed inside the blood vessel? ليش تصير خثرة دموية؟ Number one, endothelial cell damage. This could be mechanical by pressure, rupture, or torsion على blood vessel, or could be degenerative. Degenerative cause, example, atherosclerosis, الانيوريزم, والMI, myocardial infarction, or could be inflammatory, الفليبايتس, الارثرايتس, or inflammatory valve disease. طلاب. Now, I know this slide contain many new terms for you. I know. But inshallah, immediately after the mid-term exam, we will have a lecture about blood vessel. So we will discuss in details what is atherosclerosis, what is aneurysm, what is MI, what is phlebitis, what is arthritis, what is inflammatory valve disease. So now just enumerate. Okay? So now the first cause of a thrombosis هو number one endothelial damage. And I want to remind you about those students join us now. This is the endothelial cell. So first step is endothelial damage. What are the causes of endothelial damage? Could be mechanical, pressure, rupture, torsion, or could be degenerative, atherosclerosis, aneurysm, MI, or could be inflammatory, phlebitis, arthritis, etc. So now the first cause of a thrombosis هو endothelial damage. Number two, the second cause is abnormal blood flow. Okay. طلاب, كsummary for this slide, you have to know 2 points. Number one, at the artery, when there is abnormal blood flow, especially at the branching point, okay? So there will be turbulence. Okay, this is turbulence. يعني سامعين بالتربلنس اذا بالايربلين بالطياره turbulence. اوكي، يعني abnormal flow تخلخل. اوكي، abnormal بالبلد flow turbulence especially at bifurcation يعني بالبرانشنج sites of the blood vessel, بالpoint of branching, بالتفرعات. So here this is the cause in artery. Number two, بالvein هو when there is slowing of the blood or stasis of the blood. Slowing of the blood and stasis will bring the blood element together, يعني البليتلت والفبرين والRBC together until they will form clots, تخثر. So, كsummary for this slide is enough to know a second cause of a thrombosis هو is number one, abnormal blood flow. Could be in artery, yes, when there is turbulence in the blood flow at the site of bifurcation or at the site of a branching of the blood vessel. Okay? يعني for example this is the branching. Okay? يعني هنا بمكان التفرعات يصير تخلخل بجريان الدم ويكون موقع للثرومبوسيس. So at this site there will be abnormal blood flow, turbulence blood flow at the branching point. So this is a site for thrombus formation. Okay. So that's clear. So a second cause هو when there is stasis. Okay, there is a stasis or slowing of the blood flow. This is in vein. When there is a slowing of the blood flow, this will predispose for thrombosis. لما يكون الدم يجري بصورة بطيئة هذا هم يكون عامل إلى الثرومبوسيس. The third cause of thrombosis هو change بالblood constituent. كsummary, number one, when there is an increase بالplatelet, when there is an increase بالfibrinogen or fibrin, and then when there is an increase بالRBC. So, the main blood element in الثرومبس هم Number one, the platelet. Number two, الفبرين or fibrinogen. Number three, the RBC. So any cause lead to increase بالplatelets, بالفبرين, بالRBC will predispose and will cause thrombosis. So the most important point here, after surgery, after surgery here, after surgery, there will be an increase بالplatelet and not just an increase in number, okay? They will become more thicker. So it will يعني predispose for thrombosis. يعني after surgery, okay? So the patient at risk for thrombosis. Why? Because there will be increase in number of platelets or become more thicker. يعني stick يعني unite with each other to form clot. طلاب بعد العمليات الجراحية راح يكون زيادة بالبليتليت فممكن هو يسبب تخثر. لذلك افتر يعني بعد العمليات الجراحيه دائما نحتاج نسوي بلاد فيلم نتاكد انه اكو زياده بالبليتليت. وذول الجماعه اللي عندهم مشاكل بالدم يعطوهم يعني مسيلات للدم. So that's why sometimes patients with abnormal يعني bleeding time or abnormal blood constituent they will give them prophylactic يعني anti thrombotic agent يعني مثل warfarin, heparin, etc. to prevent blood clots and to make the blood to as a fluid state, not to be as يعني to prevent thrombosis. Okay, I will give you a summary. The second cause الفبرين. Okay, it increase بالpregnancy. So that's why you read sometimes, okay, or you hear sometimes that there's يعني patient, pregnant women, and then after that she developed thrombosis and she died. This is because of this have abnormal fibrin, increase بالفبرين, which will cause thrombosis and then death of this pregnant woman. Sometimes in rare condition. مرات تسمعون يعني الحامل patient pregnant woman بعدين صار عندها يعني complication، صار عندها مضاعفات، بعدين صار عندها خثرة دموية وماتت. اوكي، هاي because of increase بالفبرين during pregnancy. واللاست كوز هو الار بي سي. any cause lead to increase بالار بي سي هو ممكن lead to increase بالثرومبوسيس. واكو في كونديشن اسمه بوليسايثيميا هو means increase بالار بي سي. خلينا نسوي summary. let's make summary طلاب for this slide. Now I am talking about the third cause of thrombosis. Number one هو increase بالplatelet especially after surgery. Number two, increase بالفبرين especially during pregnancy. And number three, increase بالRBC especially in a condition we call it polycythemia. So when there is increase بالplatelet, increase بالفبرين, increase بالRBC, so the patient have a risk to develop thrombosis. خلاص. So let's make summary for our lecture for those students who join us now, because يعني I know including me يعني why I am late for 5 minutes. I have some يعني technical يعني issue problem بالنت بالكمبيوتر. So for those joining us now students, so now I am talking today about thrombosis. Thrombosis, this is a thrombosis. So thrombosis before that طارق recording ماشي عيني؟
ايه دكتور كله ماشي.
عشت ايدك شكرا عيني. So to make a summary for our talk till now, now I am talking about thrombosis. So thrombosis is a mass. طلاب definition مال thrombosis will causes كلش مهمة. Very important. You have to know the definition will causes because you will face it in your life. Okay. يعني you have to know this lecture is very important because you will face يعني in your life such patient, okay, such clinical information. Now let's يعني make summary for our lecture and what is I want from you to know till now. So now thrombosis is a solid or semi-solid mass. This is the mass formed during life from the blood constituent. What are the blood constituent? RBC, platelet, or fibrin. Inside the blood vessel, we have three mechanisms of thrombosis or three causes for thrombosis. Number one هو endothelial cell damage. What what is endothelial cell damage؟ هذا endothelial cell damage is the cell that lined the blood vessel. طبعا الفيرست بوينت هو damage to this cell. After that there will be platelet, fibrin, RBC aggregate تتجمع inside this damage area وبعدين تبدي الثرومبوسيس until this is thrombosis. هذا normal، هذا thrombosis، هذا thrombosis. okay. يعني here is blocking to the blood vessel and leaving less than 5%. 95% of the blood vessel is blocked by this thrombus. مسدود الوعاء الدموي by this thrombus. okay. Now going back to the causes of a thrombosis. Number one, endothelial cell damage, which could be mechanical, pressure torsion, rupture. Number two could be degenerative, okay, atherosclerosis, aneurysm, MI, or could be inflammatory, phlebitis, arthritis, inflammatory valve disease. السكند هو abnormal blood flow. Could be in artery, yes, when there is turbulence blood flow. يعني abnormal blood flow, especially at the site of bifurcation. Number two, when there is a slowing in the blood flow at the vein. Number three هو abnormal blood constituent, when we have an increase بالplatelet والfibrin والRBC. الplatelet usually increase after surgery. okay. هو يحصل abnormal blood constituent يعني because of the stress, hormonal, etc. bone marrow يعني stimulant, so there will be an increase بالplatelet which may cause thrombosis. may. Number two, increase بالfibrin especially بالpregnancy, or increase بالRBC اللي هو البوليسايثيميا. increase بالRBC which will cause thrombosis. so كسمري الثرومبوسيس هو تخثر أو يعني كتلة دموية تسد الوعاء الدموي بعد شو اسمه دامج للاندوثيليال سيل. طبعا شو اسمه بعد شنو بسبب اما يكون اول شيء دامج للاندوثيليال سيل هاي لايننج، وبعدين شو اسمه الميكانيزم الاخرى هو ابنورمال بلاد فلو، جريان الدم يكون يعني مو طبيعي خاصه بمناطق التفرعات، او هذا بالارتري. اذا بالفين يعني سلوينج الدم يمشي بطيء، لذلك راح تتجمع البليتلت وفبرين وار بي سي وبعدين تسوي لنا خثره، او بحاله البليتلت تزداد بعد العمليات الجراحيه، او زياده بالفبرين بعد البريجنسي، او زياده الار بي سي، كلها تتسبب الى ثرومبوسيس. طبعا انا هواي طلاب بيقولون يعني اوكي انت تشرح بالانجليزي بس احنا نريد يعني توضيح بالعربي، بس اني ان شاء الله I will make my better to explain everything in English, okay, and then have to make summary in Arabic for those students who always want for me to explain sometimes to give summary in Arabic, to give summary, but the main point, the scientific point, everything is in English, okay طلاب. okay now
عفوا دكتور، ممكن بس أسألك؟
طبعا
دكتور، احنا مثلا كأطباء أسنان بنلقي أنستيزيا، الأنستيزيا تؤدي لنا إلى فازو كونتراكشن، راح يسوي لنا إنه الفلو مال البلد راح يكون ديكريز، راح يقل، فإحنا راح نسوي ثرومبوزز للمرضى اللي يكونون عندهم سكري أو ضغط لو ما له علاقة.
والله يعني هو اوكي يعني انت راح يعني اذا عندك اذا البيشنت عنده ريسك، طبعا الهيستوري اول كلينيكال هيستوري تشيف كومبلين كلش مهم، اذا هو عنده هيستوري مال بليدنج، اذا طبعا اذا انت راح تبدون تشتغلون ك يعني خلينا نقول يعني اورال سيرجن، اوكي طبعا لازم تكونين يعني عندك فد بلاد فيلم، عندك كلينيكال هيستوري، خاصه اولد بيشنت او حتى مو اولد، اذا يونج ايج بيشنت وهو عنده مثلا بروبلم او شيء، طبعا عنده تحسس من الماده اللي هي الانستيك ايجنت من الكيميكال سبستانس، كلها تاخذون هيستوري بالكامل، اذا عنده فاميلي هيستوري كلها بالكامل. يعني اذا هو البيشنت هذول احنا بدنا نحكي I am talking for those patients who are at risk، اوكي at risk، يعني اذا البيشنت اولد ايج وهو عنده مشاكل بالصمام وعنده بالقلب وعنده مثلا شونينج مال امبولاي، هسه راح نشوف هذول خطر طبعا عليهم، نسوي فيزا كونستريكشن، طبعا انت راح تسوي ريسك اوكي ريسك ميبي لوكال، يس انتم طبعا الانستيزيا مالتكم هو لوكال مو جنرالايزد. اوكي، فيعني واحد يكون يعني تيك كير، يعني ياخذ الحذر. بس يعني انا دا احكي جنرال. بس انت يعني بيجي حاله عافيه تسوين لينك او جوين بين شو اسمه الكلينيكال وبين شو اسمه البراكتس. يعني انتم مثلا بالعمل ممكن واحد ياخذ حذر يعني فقط، بس هو يعني انت ما انستيزي هو لوكالايزد عاده. بس اذا البيشنت عندهم ريسك، لا والله واحد يكون يعني حذر. يعني اكو بعد السؤال؟
عاشت ايدك دكتور.
مثلا any question? Okay, now الثرومبس could be pale, could be red, pale or red. Now enumerate the main differences between pale thrombus or red thrombus. البيل ثرومبس بالارتري، الريد ثرومبس بالفين. طلب both of them formed of platelet fibrin RBC. But you remember when I said usually الثرومبس بالفين تكون very slowly blood, so it contain more RBC. That's why we call it red thrombus. So now enumerate two differences between pale thrombus or red thrombus. And this is an important comparison. This is an important difference. Enumerate differences. This is very important. So طلاب هاي مهمة بالامتحان in the exam. I will give you a table and I will write pale thrombus to the right side, red thrombus to the left side, and enumerate the differences. So there are two differences. Number one, pale thrombus occur in artery. red thrombus occur in vein. Number two, الconstituent is the same، يعني الكونتنت اوكي محتوياتهم is the same. لكن بالريد ثرومبس from its name, why we call it red, because it contain more red blood cell, while البيل contain يعني the same تقريبا relatively amount of platelet fibrin RBC. خلاص. الثرومبس usually have the appearance of line of Zahn. line of Zahn, this line of Zahn represent البيل layers اللي هو البليتلت والفبرين، والدارك layers اللي هو الار بي سي. Let's see. You can see here grossly by your eyes. This is pale layer هاي البليتلت والفبرين، وهاي الدارك or red هاي الار بي سي. هاي اللاينز اوكي هاي layers. So lines of Zahn KMCQ is a characteristic features of a thrombus. True. هذا MCQ كلش important. So الخثرة الدموية تكون على شكل layers طبقات. So البيل layer هاي represent معناها البليتلت وفبرين، والدارك هذا الدارك اللي هو الريد هو الار بي سي part. And you can see here هذا اللاين اوف زان، هذا الار بي سي وهذا البليتلت والفبرين، هذا الار بي سي وهذا البليتلت والفبرين. So before I will make summary, just I want from you to know الثرومبس could be septic or could be aseptic. السبتيك يعني contain bacteria، والاسeptic contain no bacteria. خلاص. Okay. Now let's make a summary. طلاب now enumerate two differences between pale thrombus و red thrombus. البيل thrombus بالارتري، red thrombus بالفين. البيل والred both of them contain platelet RBC fibrin, but the RBC is more in red thrombus from its name. That's why we call it red. Full stop. السكند بوينت هو lines of Zahn. طبعا Zahn هو scientist that discover these lines، هو العالم المخترع المكتشف هاي اللاين. الثرومبس، هاي الثرومبس هياته this thrombus contain line of Zahn. What is line of Zahn? Define lines of Zahn. lines of Zahn هي layers. الدارك والبيل. الدارك يعني هاي الريد ار بي سي، والبيل هاي البيل هاي هي البليتلت والفبرين. هاي الدارك وهاي البيل. والثرومبس could be septic إذا بها بكتيريا if contain bacteria, والaseptic when it's not contain bacteria. Okay, now my first question today for you is what is the importance of line of Zahn? Okay, why it's important to know line of Zahn? Okay, to know this is a thrombus. يعني okay, in clinical practice, what's important of يعني once I see in a blood vessel clot, خلاص this is a thrombus. This is true or false? What's the importance of line of Zahn?
To know if it is septic or aseptic.
Okay, بعد
Or diagnosis special diseases. دكتور هي دلالة على الثرومبوس يعني خلينا نقول.
اوكي بعد كل اجاباتكم يعني هو الشرح اللي انا شرحته what I explain but I want clinical importance. بعد فد فكره ثرومبس
Heart disease.
بعد
دلالة على accumulation يعني مال خلينا نقول كرات الدم البيض.
all your answers is correct but my question is what is the clinical importance? Okay, now you have a thrombus. Okay, so what يعني especially in patient after death. يلا قربت لكم إياها. I make easier for you. Patient sudden death and you see thrombus. What is the clinical importance of this?
But you say that is after it's not thrombus.
بس عفوا يعني صار جوابين بس اسمع الجواب الأول. Can you repeat your answer please?
I say that you say the first you say that there is no thrombus after death.
Doctor, I say it's a characteristic feature of thrombosis.
Okay. لا يعني now the patient have sudden death. Okay, what's the importance? Huh?
Because of this.
Yes. بالضبط. Okay. شنو اسمك عيني؟ What's your name؟ ها أزل. Okay أزل. Okay يعني زين. What's the importance of the cause of death? Okay, now we see thrombus, cause of death. Now يعني any other information? Okay, now we have a patient and the patient die and you see a thrombus. Any addition, clinical addition from you?
Maybe lead to heart attack.
Brain attack.
Okay. Now المين يعني definition of a thrombus is the solid or semi-solid mass formed inside the blood vessel during life. Okay, don't forget طلاب during life. So this patient have a thrombus which is a cause of death مثل ما قالت أزل. Okay, now after death, highly clinical information. After death, you know, all the blood will lose its fluidity and it appear as a clot. So now how we differentiate between this is a true thrombus or it's a blood clot after death? One answer, quickly.
Mass.
Next, quickly. How I know this is a thrombus? Huh?
Blood clot.
How I know this is a thrombus and not a blood clot after death? One answer.
Dry mass thrombus.
لا.
So if you see lines of Zahn.
Yes. What's your name?
مآب.
مآب.
مآب أبو بكر. نعم مآب أبو بكر.
تمام شكرا. بالضبط. Once you see lines of Zahn خلاص this is a thrombus. هذا the cause of death. So طلاب. Now, for example, this is a blood clot. I don't know this is blood clot is after death or before death. When there is blood clot before death, this is the cause of death. There is a block to the blood vessel like this condition. No blood, ischemia, hypoxia, death. So all the blood will lose its fluidity after death. and it become as a clotting. So how I know this is a blood clot, how I know this is a through thrombus, by line of Zahn. خلاص full stop. تمام. هذا الكلينيكال importance. تمام. Now السكند توبيك هو الفيت of الثرومبس أو الoutcomes of thrombosis. يعني end result. What will happen to thrombosis? Number one, propagation. Propagation يعني continue information. Number two, embolism. Embolism يعني a small piece will be detached from the thrombus, moved by blood. يعني there is piece separated from the main thrombus and go to other side by blood. Or lysis. Lysis يعني disappearance, either by shrinkage, by fibrin, or by plasmin, or proteolytic enzyme of the neutrophil, or organization and recanalization. Okay, طلاب. Now enumerate 4 mechanisms that in which the thrombus will be end, or in other way, outcomes, okay, or the end result, or the fate. Okay. Now, number one, propagation. Propagation, يعني once it's formed like this, it will continue in formation. After that, death. هذا number one. Number two, embolism, like this. يعني small piece, separated and moved by blood. Number three, resolution, or disappearance, or lysis, either by shrinkage, or plasmin enzyme, or any enzyme that digests the thrombus. Number four, here, this is organization and recanalization. يعني there will be some points of blood that can pass, some fibrosis, some inflammatory cells. Okay, now let's go back. So enumerate, هذا question important. Enumerate 4 outcomes or fate, okay, or end result of thrombosis. Number one, propagation. يعني continue بالformation. يعني once it's formed, it will continue informed. تستمر بالthrombosis. Number two, emboli. We will study that after a few minutes. Number three, lysis, يعني disappearance. Because of a treatment, because of a plasmin, because of any factor make lysis or for this thrombus. Last هو organization and recanalization. This is organization and recanalization. This is in between, not complete propagation, not complete resolution and healing. هسه just listen to me. يعني هذا الانفورميشن هو clinical. يعني patient for this type, usually this patient يعني can live normally, يعني can do the patient his or her daily normal job, but she or he will tell you that I feel of pain when I get upstairs or when I make exercise. Okay, I have يعني dyspnea after exercise, after pain. This is because of this patient can do its normal job, because there is limited amount of blood and oxygen reach to the organs, because there is not complete block, not complete disappearance. So those patients need catheterization, قسطرة, need etc etc. كسمري هذول الجماعة مال patients هذول يعني لا هم الهيلينج كامل ولا هم الثرومبوسيس بلوك كامل. لذلك يقولون أن يعني من أصعد الدرج من أسوي رياضة يصير عندي ألم أو أختنق because they have limited amount of blood. عندهم كمية محددة من البلد والأكسجين reach into the organs. So they need catheterization قسطرة على مود يعالجون. And don't worry, what I want from you to know is 4 points. The outcomes of thrombosis. Number 1, propagation. Number 2, emboli. Number 3, lysis and disappearance. Number 4, organization and recanalization. هذا الاورجنايزيشن والريكاناليزيشن. اوكي، يعني fibrosis واندوثيلايزيشن واكو blood pass but limited. Okay, they need treatment. Now, any question till now? Okay. النكست توبيك هو الامبوليزم. الامبوليزم or emboli هو mass transfer by the blood to a site distant from its point of origin. This could be solid, could be semi-solid, could be liquid, or could be gas. For example, so this is a thrombus. When there is a small piece separated from this thrombus, it will move by blood to other sites. This is emboli. So emboli is a mass, solid, semi-solid, gas, or liquid, move from its site of origin to distant site, move by blood. So emboli, 99, very important, put line, 99% of the emboli originated from thrombus. 99% من الامبولاي هم من الثرومبس. But 1% could be bone, could be bone marrow, could be atherosclerosis, could be tumor, could be foreign body, could be amniotic fluid, could be air. Yes. So emboli is a mass transferred by blood. Could be solid, could be semi-solid, could be liquid, could be gas. This mass moved by blood to distant site from its site of origin. And most important to know from where their origin, 99. Okay, as it's shown here, 99% from the emboli originated from thrombus, while 1% could be tumor, could be bone marrow, could be air, could be fluid, etc. يعني most common cause of embolism هو thrombosis. So embolism هي mass moved by blood. تمام؟ This mass until it will impact. Impact يعني this mass will move by blood until it will block one of the tiny blood vessel. Here we call it impaction. يعني it will move by blood until it reach to the site that it cannot move. So it will block. So an emboli is a mass transferred by blood to a site distant from its origin. Usually 99% the origin of this emboli is a thrombus. But 1% could be airborne tumor. So this movement will move by blood until it will move to small blood vessel that it cannot move until it will impact, block this blood vessel. تمشي الامبولاي بالبلاد لحد ما توصل أوعية دموية شعيرية صغيرة جدا هناك توقف وتسد البلاد vessel. So this is impaction. It moves until it will impact the blood vessel, block the blood vessel. According to this, we have pulmonary thromboembolism or systemic embolism. الpulmonary thromboembolism from its name, pulmonary thromboembolism. Pulmonary يعني related to lung. Thrombosis or embolism. So this is the most common preventable cause of death in hospitalized patients. 95% have origin from thrombi within the vein of calf muscle of the leg, deep vein thrombosis or DVT. What's this, طلاب؟ هذا diagram. So now I am talking about, we have two systemic of embolism impaction. Number one, pulmonary thromboembolism. Number two, systemic embolism. Now I am talking about pulmonary thromboembolism. This is usually seen in an old age patient. Seen in old age patient, usually hospitalized. What is hospitalized? يعني long bedridden in hospital. يعني for example fracture, paralysis, يعني stay in hospital for a long time without movement, with no movement. So after that, there will be stasis and slowing of the blood at the calf muscle, يعني بالlower extremities. And then there will be thrombosis. This is thrombus. This is thrombosis will be in the lower extremities. And then this emboli will, and then this thrombus will give an emboli, small piece, will separate it from the thrombus, move by blood until it until it reach one of the small blood vessel. Okay, and then there will be an impaction. Okay, بس please يعني close your mic. Okay, so the first mechanism هو pulmonary thromboembolism. So in pulmonary thromboembolism اي والله طلاب يعني مين فاتح المايك رجاء؟ Okay, now I will repeat. طلاب, I am talking about pulmonary thromboembolism. Now usually seen in patients stay in hospital for long time. Those patients with fracture, with paralysis, so there will be no movement of the blood, especially at the lower extremities, for a long time. So there will be stasis of blood, slowing of the blood at the lower extremities. Then there will be thrombosis. Then there will be small piece from this thrombosis will move by blood until it reach into the lung, and it will block one of the branching of the lung blood vessel, impact there, and it will cause ischemia, hypoxia, and death. I repeat. Now I am talking about, let's for it to be oriented, I am talking about pulmonary thromboembolism. Here, pulmonary thromboembolism, usually this is the most common cause of a thrombosis in hospitalized patients. يعني you hear that patient have, for example, old age, long bedridden, no movement, stay in hospital. So there will be thrombosis بالcalf muscle, بالlower extremities. This thrombosis will give emboli. This emboli will move by blood until it will impact tiny blood vessel بالpulmonary until, and then it will cause infarction, ischemia, necrosis. So that's why every patient in hospital, once you go to hospital and you visit your relative, لا سمح الله, have يعني long bedridden, the doctor will advise the relative of the patient to move his legs, to make massage, to flexion, extension of the legs. If the patient cannot move, if the patient can move, you hear that at the same day of operation, the surgeon will advise the patient to move You know this? Okay, yes, I am sure that all of you see the patient. If the patient can't move at the same day of operation, they advise the patient to move even in his room or her room in the corridor, okay, because to prevent stasis and slowing of the blood and to prevent thrombosis. طلاب دول الجماعة اللي نايمين بالمستشفى فترة طويلة no movement ماكو حركة لذلك those patient عندهم قابلية للتعرض للثرومبوسيس تخثر بالأوعية الدموية بالأطراف السفلى. لذلك انت تشوفون من يسوي العمليه المريض نفس اليوم الطبيب الجراح يجي يقول له امشي امشي ايش قد ما تقدر امشي امشي احسن على مود بريفنت ثرومبوسيس. اوكي، لانه اذا بقى نايم بدون حركه راح يصير عنده تخثر ويموت. ليش؟ لان راح يصير عنده تخثر بالاوعيه الدمويه بالاطراف السفلى، راح يصير عنده امبولاي شاورنج امبولاي، يعني سمول بيس تمشي بالدم توصل لللنج ويقول لك صار عنده جلطه رئويه ومات. So that's why we advise every patient not to be in bedridden for a long time. If the patient have paralysis or a fracture, إذا المريض عنده كسر عنده شلل، okay, the relative of patient have to make massage, to make flexion, extension, and to prevent thrombosis. To prevent thrombosis. Okay, now we finish this side, this topic. السكند هو السيستميك يعني
هذول البيشنت مو يصير لهم اديمه ايضا؟
بالضبط هو شلون انت كلينيكلي ما ادوخكم كلينيكلي راح تشوفون هذا البيشنت الليج مالته هو هوت وتكون ريد وتكون إديمة، يعني immediately that this is a sign of a thrombosis. Okay, and after that yeah, there will be emboli moved by blood until it will cause lung ischemia or death. طبعا those patients يعني usually long bedridden وهاي يعني they give him heparin warfarin like this يعني blood to prevent يعني blood clot and thrombosis. اوكي، السيستميك امبوليزم هو الاوبوزيت، هو الثرومبوسيس اوكي is usually بالهارت اوكي after MI myocardial infarction يعني myocardial necrosis myocardial death. Then this will move by artery until it will block one of the blood vessel of the lower extremities. Okay, here it's more liable for infarction for necrosis. Okay, خلاص خلي اسوي سمري. اكو بعد عندي شيء؟ تمام. Let's make summary for embolism. So embolism is a mass moved by blood or move in the blood. 99% of emboli originated from thrombus, but it could be يعني 99% they are solid or semi-solid. Why? Because they are thrombus. 1% could be air, could be bone, could be tumor. Now this small piece which is separated from the thrombus will move by blood until it will impact in small blood vessel. According to this, we have pulmonary thromboembolism, usually seen in patients with long bedridden for a long time, no movement. Next step, stasis of blood. Next step, thrombosis in lower extremities. Next step, emboli moved by blood cause block to the one of the pulmonary blood vessel. السكند هو systemic emboli. السيستميك emboli as simple as that طلاب no extra information. هو seen after MI يعني myocardial infarction or myocardial necrosis okay in the heart يعني thrombosis بالبلد vessel مال heart and then there will be emboli will move by blood. This emboli will move in artery and it will block one of the small blood vessel in the lower extremities and it will cause more infarction than in the first point. هو هذا الامبولاي خلاص بس هذا what I want from you to know or what is included for you. Any question about emboli? Now, any question regarding embolic لا ماكو شيء. Okay. Now, ال last topic today. طلاب, how many lectures we have before midterm? كم محاضرة عندنا قبل الميد تيرم؟
تقريبا 10.
جيل عيني؟
10.
لا مو معقولة. لا ميد تيرم هو يعني كم محاضرة باقيت لنا قبل الميد تيرم؟ هو الميد تيرم مو بنهاية الثالث؟
دكتور هو حاليا ما معروف يعني يمتى الامتحانات بسبب هاي الظروف الأخيرة.
ها يعني خلينا نقول على السكيجول القديم.
باقي 3 محاضرات دكتور، محاضرتين 3 محاضرات.
يعني خلينا نقول يعني باقي 3 أسابيع.
تقريبا أسبوعين دكتور إذا على القديم نمشي يعني.
ها أسبوعين. ها أوكي تمام. شكرا طارق عيني. تمام. So last topic today هو الانفاركشن. الانفاركشن means necrosis. Infarction means necrosis. So infarction, you remember when I said cell death, necrosis, infarction. So infarction is usually due to sudden reduction or cessation of its artery or block to its venous drainage. يعني either block or reduction بالartery blood supply or impaired or abnormal venous drainage. Now most cause for infarction اللي هو النيكروسيس اللي هو الفاسكولار obstruction. والmost common cause هو thromboembolism. هاي thrombosis embolism. Less frequent cause atherosclerosis. We will study inshallah after midterm. Spasm, pressure, or twisting or torsion. The pressure of the blood vessel والtwisting or torsion هو usual for the veins, while the atherosclerosis والspasm هو for artery. So now infarction means necrosis. And most common cause of infarction هو vascular obstruction, either to the artery or impaired venous drainage. Now, this is very important cause. Enumerate causes of vascular obstruction. Number 1 is thrombosis embolism. هذا number 1 on the top list. Next هو atherosclerosis أو spasm of the artery or pressure or twisting or torsion of the blood vessel. Now, الانفاركشن could be pale or could be red. Pale or white infarction or hemorrhagic or red infarction. Now, let's to remind you. I know you remember this slide. هذا الهارت وهذا cut section through the heart وهاي this zone represent a pale or white infarction or white necrosis. هذا MI myocardial infarction or myocardial necrosis. هذا الوايت. And you remember this slide. This is the red infarction. This is normal intestine, normal bowel. Oh, this is the red or hemorrhagic intestine or hemorrhagic infarction. Now, enumerate differences between a pale or white infarction and red or hemorrhagic infarction. البيل seen بالartery بالارتري. الريد or hemorrhagic seen بالفين. البيل or white infarction usually seen in solid organ, example الهارت والكدني, while الred seen in loose tissue, okay, and usually example lung والintestine. خلاص. So now the question will be like this. Enumerate, very important, the differences between white or pale infarction and red or hemorrhagic infarction. Pale or white seen in solid organ due to artery block, example الهارت والكدني, while red or hemorrhagic seen in loose or soft organ due to vein block, example lung والintestine. طبعا usually they take the shape of wedge shape. هذا الويدج shape. What is wedge shape? This is the wedge shape. يعني look like a triangle. The apex of the triangle, this is represent the site of a blood vessel block, and this zone represent the zone of necrosis. I will make summary after 2 minutes. Now you remember myocardial infarction والنكروسيس هو usually coagulative necrosis. Okay, so this is normal and this is normal and this is abnormal or necrosis. What is the main features of myocardial infarction under light microscope? Under light microscope, what is the main features of myocardial infarction?
structure this.
شنو يعني؟ بس can you repeat your answer؟ ممكن تعيدين الجواب؟ What is the main features of myocardial infarction?
outlines or shoulder
بالضبط
structure
بالضبط. أزل مو أنت يعني؟
نعم أحسنت.
بالضبط تمام عشتيدك. بالضبط هو features مال coagulative necrosis هو preservation of the basic structure outline but no nucleus with increased cytoplasmic eosinophilia. بالضبط. اوكي هذا الانفاركشن وهذا اللاين اوف demarcation وهذا still. So this is in between, not death and not complete healing. Let's make summary. So infarction means necrosis, means cell death, usually of coagulative necrosis. Usually the most common cause of infarction هو vascular obstruction. Cut the blood supply, no blood, no oxygen, infarction. Quickly, what is the most common cause of infarction?
Cognitive necrosis.
Cause. What is the most common cause of infarction?
ischemia.
What is the most common?
Thrombosis.
عفي thrombosis. منو قال؟
And
تمام عيني. بالضبط طلاب. As I told you, الانفاركشن يعني necrosis يعني cell death. والmost common cause of infarction هو vascular obstruction. والmost common cause of vascular obstruction هو الcauses of vascular obstruction هو most common cause هو thrombosis embolism. So KMCQ, the most common cause of vascular obstruction is thrombosis and embolism. True. While less common اللي هو atherosclerosis, spasm, torsion, pressure, twisting, etc. Now, compare between pale infarction and red infarction. it's very important. البال infarction seen in artery block. الred or hemorrhagic infarction seen due to venous block. الwhite or pale infarction seen in solid organ, while red or hemorrhagic infarction seen in loose or soft organ. Example of white or pale infarction اللي هو الهارت. This is the heart. هذا البيل or white infarction while or kidney, while الهemorrhagic or red infarction example باللنج أو الintestine. Usually الinfarction take the shape of wedge shape. This is the wedge shape. هذا look like a triangle. The apex of this wedge shape هذا triangle represent the site of a blood vessel block, and then this is the remaining هو necrosis. So كسمري الانفاركشن يعني موت الانسجة بسبب انقطاع الدم، والmost common cause for this هو الثرومبوسيس والإمبوليزم. Okay, we have two types of infarction اللي هو الred والwhite. You have to know the main differences between them. الانفاركشن microscopically usually is of coagulative necrosis. يعني we see preservation of the basic structure outline while loss of the cellular details. يعني no nucleus, no other features. يعني infarction means necrosis. Which type of necrosis? هو coagulative necrosis. Okay, now we finish our lecture today. We finished the thrombosis, والembolism, والinfarction. طلاب, these are three important topics. I explained يعني briefly and precisely and the main point that you have to know. Any question, any comment, أي سؤال, أي تعليق, أي slide to be repeated by me? Okay, now I will ask. 68-year-old age patient had an operation, and this patient stay in hospital for 5 days with no movement. After that, the patient die. So, what is the most common cause of death for this patient?
ثرومبوزيس على اغلب.
بالضبط. انت ازل شاركتي هواي. انت شنو اسمك عيني؟
ورد.
عافية ورد. طلاب اللي شاركوا يعني خلي يعطون مجال زملائهم، بس اذا ما عرفوا خليهم يشاركون. بالضبط. Now الكوز is thrombosis. السؤال الثاني, where is the thrombosis? السايت. علي كيفكم. I am talking بالضبط. I am talking where is the site of the thrombosis?
بالليج دكتور.
عافية الليج. اول واحد منو قال لي ليج؟ اول واحد
صعب.
شنو مصعب؟
صعب علي.
عافية. تمام. Okay, a thrombosis happened in the leg, and then the embolism will move by blood to where?
بالمونري دكتور.
بالضبط. To the pulmonary or lung. شنو اسمك عيني؟
مصطفى فيصل دكتور.
شنو عيني؟
مصطفى فيصل.
ها مصطفى فيصل. بالضبط. هذا البيشنت and the long bedridden, no movement. There will be thrombosis in the lower leg, and then this thrombosis will lead to emboli. So emboli will move by blood until it reaches the lung, and it will cause the death of this patient. Now, very good. Now, if we take biopsy from the lung of this patient, so we will see necrosis. Which type of necrosis? Liquefactive or coagulative?
coagulative.
بالضبط. عافية. من أول واحد جاوبني؟ تمام، أنتوا أجوبتكم كلها صحيحة، بس أول واحد منو عيني؟ أحد يساعدني؟ من أول واحد؟ أنا ما أعرفكم. هند أياد موافقين كلكم؟ طارق إذا موجود.
دكتور إذا أني أعرف.
هند أياد أول واحدة جاوبتني؟ تمام. أنت مجاوبة هند أياد. منو ثاني واحد؟
جيار عادل.
جيار عادل.
نعم دكتور.
تمام عيني. Okay. Now the second question. Okay. Now you have a patient with يعني هذا البيشنت هو اللنج يعني sorry. So you have a patient now, a young age patient, sudden death. Okay. And now you examine the lung of the patient and you notice nothing in the lung, but you notice that there is thrombosis in the one of the blood vessel of the heart. Okay. Now what you have to see in this thrombus to know that this is a true thrombus during life and not a blood clot.
line انهس.
بالضبط. lines of Zan. من اول وحده عيني.
شهد عبد الكريم.
صعب علي.
لا انت مصعب علي مجاوب خلاص. شنو اسمك عيني؟
شهد عبد الكريم.
شهد
عبد الكريم يس.
تمام بالضبط. اهم شيء تعرفون طلاب you have to know line of Zan is the main features of thrombosis that differentiate it from blood clot. طلاب هذه هيك clinical cases راح تكون الاسئله حلوه واني ان شاء الله انتم كلشم مسيطرين. you answer all my questions and I may ask you like these clinical cases ك true false or ك single choice. I don't know exactly the style of the question and it will be as simple as that. الأسئلة حتكون بسيطة وسهلة إذا أجيب clinical cases مثل هاي. Before you leave, any question, any comment? Okay. إن شاء الله next lecture will be at 9 a.m. Sunday. طلاب المحاضرة القادمة إن شاء الله حتكون يوم الأحد الساعة 9 صباحا إن شاء الله. Okay. Now, if you don't have any question, you can leave. Okay. See you إن شاء الله. يلا مع السلامة عيني.
دكتور.
نعم.
May I ask a question?
Yes طبعا.
Regarding the previous lectures, continuous dividing cells have stem cells, right?
Yes.
What about the second type, stable cells? Do they have stem cells?
Yes, they have stem cells, but their stem cells are genetically not programmed to divide daily. They have a limited ability for division. Okay. Now these specialized stem cells are activated when there is a stimulus or when there is يعني response to something abnormal for these cells. Example بالliver. So these stem cells will start to form a new cell when there is a stimulation.
Thank you, doctor. So they do have stem cells.
Yes.
So what types have stem cells?
Yes, they have stem cells, but they are differ from the first one. They are not as the first one.
Activated.
Yes. تمام.
Thank you so much, doctor.
يلا ويلكم. اهلا وسهلا. يلا جود باي مع السلامة عيني.